Hello. In this webinar, we will discuss how to decide what benefits are right for your business and your team.
The information contained here has been prepared by Civitas Strategies Early Start and is not intended to constitute legal, tax, or financial advice. The Civitas Strategies Early Start team has used reasonable efforts in collecting, preparing, and providing this information, but does not guarantee its accuracy, completeness, adequacy, or currency. The publication and distribution of this information are not intended to create, and receipt does not constitute an attorney-client or any other advisory relationship. Reproduction of this information is expressly prohibited. Choosing whether to offer staff benefits is a hard decision. Often cost and affordability are primary factors. While compensation is likely the number one factor in an employee's choice to enter and stay in a job, benefits are also a critical piece of their decision. Certainly the cost of employee benefits adds another expense to your balance sheet. However, you must not minimize the invisible cost savings of the value that benefits bring to your business. Today's conversation will explore why you should offer benefits to your employees, what are some commonly offered benefits, and what's next for you in deciding to offer benefits. Now more than ever, you may be thinking about the culture of your workplace and ways to reward and invest in your staff and attract qualified staff to your program. Benefits can be a vessel to do that in a tight job market. While benefits come with a cost, failing to offer them could also have financial consequences for your business through the loss of loyal staff, the inability to recruit employees and staff your program, and the impact of unsatisfied employees. In this work, you know how critical it is to attract and keep skilled staff members. The bottom line is that benefits are important and childcare businesses should aim to incorporate them whenever possible. You should be an informed consumer as you research your options and understand what's available and what questions you should be asking. Depending on your company size and whether individual employees meet certain requirements, there may be some benefits that are legally required of you, such as Workers' Compensation, Family and Medical Leave Act, FMLA, and even medical insurance. There are also other benefits that are not required but are common amongst employers and are a critical decision-making factors for employees when choosing a place to work. We will explore a few of the common benefits that a company can offer employees. Paid time off, PTO, is one of the most common benefits and is widely appreciated amongst staff. This can include holidays, vacation, and sick days. Having the opportunity to access PTO can improve staff's overall well-being, which can help reduce stress and burnout, especially in a job as demanding as childcare. There's no hard and fast rule on how many PTO days should be offered, and the amount of time offered can gradually increase with more time on the job. Health insurance is usually one of the first things that comes to mind when someone thinks of the term benefits, and is highly sought after by employees and job candidates. As such, if there is any one benefit worth offering to your employees, health insurance is the one to consider. In addition to medical coverage, this benefit can include dental, vision, and prescription coverage. Options within this offering range from full insurance to telehealth to discount programs. Typically, you would find a benefits provider and offer your employees certain benefits from that provider. You could cover a portion of the cost, and the employee would pay a set amount per pay period toward the cost of their plan. Alternatively, another option is to simply coordinate the health plan coverage for your staff, offering coverage without financially contributing to the employee's elected coverage. Blue Cross Blue Shield and Aetna are two private insurance companies that were frequently named by childcare providers across various states when asked what companies they used. Small businesses can also help their staff to sign up for the Affordable Care Act, ACA. The ACA is a comprehensive health care reform law that provides affordable health insurance for individuals. This law addresses health insurance coverage, health care costs, and preventative care. Health insurance premiums continue to decrease in 2022 and are based on family size and income. To learn more about affordable health care options, visit Wisconsin's Health Exchange website, which is linked with this video. Retirement plans allow employees to build financial savings to help them meet their personal long-term financial goals. While employees who opt in will need to contribute their desired amount of salary per pay period, the benefits that are provided by these plans are individual tax savings. and having the ability to receive a set amount or a match to their contribution from their employer. This will allow their contributions to grow faster, setting them up for higher earnings during their retirement. Supplemental insurance programs include coverage such as short or long-term disability, accidental, or other plans to cover unexpected critical health events. Employee assistance programs are another example of supplemental insurance which could give employees access to programs providing mental health or other well-being supports. These are typically more affordable than offering medical insurance, however, do not replace it.
Staff professional development is an integral part of the childcare business model. Not only are there requirements around staff trainings, but the more knowledge your staff have in child development, the better the experience will be for the children in care. Many providers find that they can provide these benefits for staff through participating in programs such as the Teach Early Childhood Scholarship Program provided by the Wisconsin Early Childhood Association. Offering discounted childcare to your staff's own children is a great benefit that most childcare programs find easy to implement. Not only will this benefit give staff peace of mind, but it can also help them to afford the expense of childcare, which otherwise would be a larger line item in their personal budget. The ability to receive bonuses is a benefit that many employees value, especially during these times as staff have had to work harder, longer hours, and under challenging circumstances. There is an opportunity to reward hardworking employees for this additional effort through temporary pay increases and bonuses. Visit the Financially Invest in Your Staff with Temporary Pay Increases or Bonuses resource to learn more about this benefit and structuring bonuses. And ensure that you and all eligible employees apply for the Reward Stipend Program administered through the Wisconsin Early Childhood Association. I'm ready to offer benefits. Now what? First, you should understand what benefits you would like to offer based on your organization's budget and goals, as well as your employees' needs. Then think through the types of benefit providers that will help you to make it a reality. Here are some benefit providers that you may come across.
Private insurance providers are what we typically think of when we think of traditional insurance providers like Blue Cross Blue Shield or Aetna. The most common type is a group plan purchased by the employer that covers employees and possibly their family members. These plans may cost less than an individual seeking their own plan. However, they can still have a price tag that may be too costly for the average childcare provider's budget. You can set how much of the cost you would cover versus the employee. You can buy these plans directly from an insurance provider, a broker, or your state's health insurance exchange. Outside of offering company-sponsored health insurance, you can still support your employees on an individual basis in accessing low-cost or free health insurance through the Affordable Care Act marketplace. You can help ensure that employees are aware of what they may qualify for and facilitate a connection for them to work with a free healthcare navigator who can walk them through their options. To learn more about affordable healthcare options, visit the resource connected with this video. Existing payroll companies and online services like Gusto, Paychex, Zenefits, and others may be helpful too. Employers may be able to purchase group insurance and supplemental plans through their payroll provider. These providers can act as a broker, streamlining the process and helping you find plans that best fit your needs. Professional employer organizations, PEOs, offer a way to outsource the human resources functions of your business, and they cover things like payroll, employee handbooks, benefits, etc. PEOs serve as the professional employers of their clients' employees. PEOs also allow for small businesses to offer benefits that are usually associated with larger companies, as they're able to leverage their large network of employees to offer more affordable rates for insurance and benefits.
A shared services network or other platforms for collaboration, for example, Wisconsin's Early Education Shared Services Network, or WESN, the Chamber of Commerce, etc. By participating in these networks, you can receive discounts on certain benefits through companies that partner with the network, such as medical or telehealth, dental, even vision. You could also have access to money and time-saving services like insurance brokers and enrollment specialists to guide you through the process of setting up a benefits plan. Typically, membership fees to join these networks are low or no cost. There is no cost to join WESN.
So how do you determine what you can afford? Some benefits can be offered at little to no cost. Remember, there may be invisible costs that offering benefits could actually help mitigate. Costs associated with employee turnover, such as recruiting, interviewing, training, and onboarding, and vacancies in your classrooms can be potentially offset by offering benefits. Talk with a child care business coach to understand just how much employee turnover is costing your business and to explore planning your budget and cash flow so that you can begin to offer benefits. Let's look at these key considerations for health insurance and tax credits that can offset the cost of implementing certain benefits. When considering health insurance, know that the offerings are incredibly varied. Costs are based on number of employees covered, your location, ages of the employees and their dependents, and what percentage of the health insurance premium you'd like to cover. You can choose a no or low cost option, which means you arrange a group insurance plan for your staff without paying any premiums. This places 100% of the plan cost upon the employee. A higher cost option would be to cover a portion of the insurance premium for your employees. Typically, this portion begins around 50%. This places the remaining portion of the plan cost upon the employee. Employees can add family members to the plan at their own expense. And the highest cost option is for you as the employer to cover a portion of the insurance premium for the employee plus dependents. Typically, this is a spouse and/or children. Small businesses can benefit from a tax credit that will reimburse you for half of your contributions toward your employees' premiums, as long as you cover at least 50% or more per employee. There are other guidelines that you must meet, which in most cases a typical small to mid-sized child care business would. For example, if an employee's monthly premium is $235 and you pay 50% of that, you would be eligible for a tax credit of $58.75. Even though the annual cost to you is $1,410 for this employee's benefit, you would receive back $705 when you file your tax return. To learn more about this tax saving opportunity, visit the Small Business Healthcare Tax Credit and the SHOP Marketplace for Virginia. On this website, they give you an example of starting costs for health care insurance plans. Remember, these figures do not include dependents. If you choose to cover dependents premiums as well, these costs will rise. Costs can be much greater than those outlined in the table based on your circumstances and selections. Small businesses that start up a retirement plan can benefit from the Setting Every Community Up for Retirement Enhancement SECURE Act tax credit. Eligible employers may be able to claim a tax credit of up to $5,000 for 3 years for the setup and administrative fees associated with starting a SEP retirement plan, simple IRA, or a 401k plan. You can learn more about this opportunity from the resource accompanying this video. Be sure to talk with your tax professional about this tax credit opportunity. Once you've thought through the criteria that an employee must meet to be eligible for benefits that your program offers, next you may think about the cost, how the benefits will be administered, monitored, and tracked within your system. As you decide which benefits to offer, here are some questions to answer. Is this benefit affordable for the long term? What will be the return on my investment? Does it fit the unique needs of my employees? Will they find value in it? If I want to increase staff retention, for example, will this benefit help? What are the total costs, including fees and time, to administer this benefit? What are the pros and cons of offering this benefit and/or selecting this particular benefit provider? Many childcare providers view offering staff benefits to improve their operations by boosting morale, decreasing staff turnover, and investing in the longevity of their most important asset, their staff. However, providing benefits can also offer financial benefits through tax deductions, credits, and time savings. Once you decide to offer benefits, be sure to document your policies and update them as things change. While you are not required to offer certain benefits, you are required to follow the benefits policies that you've set forth. We recommend updating your policies and reviewing benefit offerings at least annually. This will help you stay on top of your needs and your employees' needs as they change.
Additional resources for early care and education can be found at the Wisconsin Early Childhood Association or WECA website. If you are not a member of the Wisconsin Early Education Shared Services Network, you can click here to learn about business training and support it offers. If you are ready to join the Wisconsin Early Education Shared Services Network, you can also click here to join